Welcome to 5 Tips for Safe Medication Management. My name is Sydney and I'm here with Dr. Schumacher, and we are part of the Your Care Plus team. Connie is a registered nurse with 20 years of clinical experience in cardiac and emergency care and 5 years of experience in community nursing. She's an assistant professor in nursing at Brock University. She's here to talk to us about 5 tips for managing medication. Our first tip for safe medication management is to know your medications.
Right. So knowing your medication is the first step in medication safety. Medications come in many forms, pills, puffers, ointments, suppositories, and injections. It's important to talk to your doctor, your nurse practitioner, or your pharmacist to find out what your medication is for and why you're taking it. When you're prescribed a medication, your pharmacy often gives you some printed information. Take the time to review this information and ask questions. Don't be afraid to ask questions. That's what we're here for. Some important questions that you may want to think about is, can you expect any side effects? What do you do if you do experience those side effects? And what do you do if you miss a dose?
Tip number 2 is to take your medication as directed.
So you'll find all of that information actually on the medication bottle or with the prescription label. There are several things that you can find on the label. The first is your name, and the next is the name of the drug, as well as the dosage. So how much are you supposed to be taking and how often you're supposed to be taking it. Also on the label, you will find the name of the prescriber. So who prescribed this medication, which is sometimes helpful if you have multiple people looking after you in your circle of care. Also on the label, you will have the date. So the date is important, especially if you are in and out of hospital. You may have multiple bottles of the same medication. So you can check the date on the bottle to see which one is the most current one. Also on the label, you will find whether or not you are allowed to have repeat medications. So it's important to take your medication as directed.
Tip number 3 is to go to the same pharmacist.
Right. So going to the same pharmacist is really important. Your primary pharmacist will know your drug history, and they will know you a little bit better. So they know your medications as well as any previous interactions or medications that you had difficulty with in the past. Think of your pharmacist as an important part of your health team.
Tip number 4 is to keep an updated list of your medications. This includes supplements.
Right. So it's really important to have that updated list of medications and to take it with you whenever you go to any sort of care provider appointment. What are supplements and herbal remedies? Well, those are important to include on your list as well. Many supplements interact with your prescribed medications. Common supplements that you may think about are your vitamins, multivitamin, so individual vitamins as well. You may also be taking a combination herbal remedy. And what's important about this is these can interact with your prescribed medications. So it's important that you include those on your list as well. You may also be taking over-the-counter medications. So over-the-counter medications are any medication that you purchase that you did not require a prescription for. Commonly cough and cold medications, pain medications, laxatives. So all of these things need to be included on your up-to-date medication list.
Tip number 5 is that there's many options for dispensing and storing medications.
So one of the things that you can think about, if you're having difficulty swallowing your medications, the pharmacist can let you know whether or not it's safe to crush that medication and mix it with applesauce or pudding or something that's easier to swallow. So there are different options for you. One of the other common concerns is that there are a lot of medications. So taking a lot of medications at a variety of times during the day can be a little bit confusing at times. So there are some options out there for that as well. One of them is called the blister pack, and that is a pack that is prepared by your pharmacist where they divide out your medications so that you know what to take at what time of the day. There's also dose sets where your pharmacist will fill the dose set for you, or you can purchase your own dose set and fill your own weekly schedule of medications. There are also some options for changing the actual container that you're using so that it's easier for you to open.
If there's one thing that you want people to take away from these tips, what would that be?
I think the important thing is that you need to know your medications, how to take them safely, keep that list, an up-to-date list, and don't be afraid to approach your pharmacist, your family doctor, nurse practitioner with any questions or concerns that you have. We're here to help you take your medication safely.
Please visit www.yourcareplus.ca for helpful tools and information to assist with caregiving in the home. Follow us on Twitter, Instagram, and Facebook using the handle @YourCarePlus, and subscribe to our YouTube channel to see more health professionals discuss helpful tips for caregiving.